we wanted to take the time to interview someone who's sitting in this expert seat that you are during Alzheimer's and Brain Awareness Month. And I know it's a topic that is incredibly passionate to you. It is also one that's very near and dear to me. And I'm going to start by asking you if you could share the story behind Clear Guidance and what motivated you to start this organization.
I'll start with how I was inspired to get into this work, and then that will lend itself into the story of Clear Guidance. So when I was a young child, my grandmother was diagnosed with Alzheimer's disease when she was in her late 50s. And you can imagine that at the time in the 1980s, we didn't know much about Alzheimer's in 80 and 90-year-olds, forget Alzheimer's in, a less than 60-year-old woman. And so it was very difficult. And it started with the difficulty around getting a diagnosis for her. And they diagnosed her with a lot of different things. One of my favorites was complications of menopause, right? So they really didn't know at all what was happening. And as a result, some of the things that we are worried about with people with dementia happened to my family. So my grandfather became very isolated from friends and family who stopped visiting because they weren't sure how to handle what they were seeing. And my grandmother's responses to their questions. He hired the housekeeper to be the private caregiver. And he started to neglect his own health and to drink more than he should have to address the stress of the caregiving. When her mobility became challenged, he carried her from room to room because his home did not accommodate a wheelchair. And as a result of the stress and the difficulty here, he died before she did, as a result of really pushing himself too hard in the caregiving role. And so this was an incredibly poignant experience for me. At the time that this occurred, I was a young person just getting into college and trying to figure out what direction I wanted to go in my life. And this was a very inspiring story for me, and left me with a lot of questions, mostly around how can this be done better? And I want to be part of it. And so that was sort of the driving force behind my career, and has been what's pushed me all these years to continue being part of working with people with Alzheimer's and dementia. So it's been a career-long passion for me and something that I really focused on in graduate school. And I found this field of consulting and care management right after I finished graduate school, and felt that this was such a perfect fit for the application of the skill and the passion that I have developed, but always was drawn to the cases that involved dementia, Alzheimer's disease, and all of these other atypical dementias. And so when I had the opportunity to go out on my own, it was my focus to create an organization that was supporting specifically families that were dealing with Alzheimer's and dementia as part of their aging process, and also to help families who experienced young onset, like my family, as the resources are even fewer and far between for those families. So that's what led to the creation of Clear Guidance. And it's been an exciting road, to say the very least.
It certainly has. And I have to say, with your story, you triggered all sorts of kind of feelings from my side, as my mother's story was very similar. And I watched my dad as a caretaker go through almost exactly what you were describing. And when my mom did eventually pass away, it was really interesting because my dad almost turned the corner instantly of like not having to do everything that he was doing, and seemed to get younger right in front of our eyes. It was very interesting how it taxes on both sides.
Well, it's interesting, Liz. I'd like to tell you, just to piggyback on that a little bit. with a few more years of experience and more knowledge about the field, unfortunately, my aunt was also diagnosed in her 50s. This would be my grandmother's daughter, right? But this time around, I knew more. We as a family knew more. And so I am very proud to say that my uncle, who is no less dedicated a care partner to my aunt, was able to continue working. He was able to get the support that he needed as a caregiver. He was able to access assisted living when he needed it for support. He was able to access hospice in his home at the end of her life. And he is with us today, spending time with his children and grandchildren. And I'm just grateful for everything I've learned and everything we've learned in this field. So we know better how to support caregivers. And as you say, with your dad, you saw a real difference, a weight lifted, right? And there's no doubt about that. But we also have to focus on the weight as it exists and how do we help people that are in the middle of that care partnering role to manage the stress and the burden of caring for someone with these
Absolutely,
diseases.
110% agree. And it leads right into the next question, which is, as we recognize Alzheimer's and Brain Awareness Month, why do you think raising awareness about dementia and Alzheimer's disease is important? And that's the question, but I also want to focus on the change that's occurred from where this knowledge used to sit to where it's coming to now.
First, what's most important about awareness? I am always shocked when someone comes to me and says, I don't know anything about dementia or Alzheimer's disease. It shocks me because this is my daily life. I live and breathe this stuff. But the truth of the matter is, people still don't know all these years later. And there's still a relationship both between mental health disorders and this neurological brain disorder. There's also confusion about what's normal aging, or as we used to call it, senility, right? And an actual brain disease. And unfortunately, I think there's a lot of the population out there that just thinks that memory loss and issues with executive functioning and judgment and all of that are just part of aging. It's not part of aging. It isn't part of normal aging. And so there's still a lot of awareness that needs to be made. I also think that research in this area has been put on the shelf because it is something that happens to old people who have already had productive lives and lived 70, 80, 90 years. So why do we need to put a lot of money into research when this is an inevitability of aging? It's not an inevitability of aging. It doesn't have to be. But a lot of the research progressed very slowly because there was this stigma to it, and not a lot of money was being invested either by private citizens or by the government to research this. So we are so far behind in Alzheimer's and dementia research than we are in comparison to something like cancer or heart disease, right? And so that's one of the reasons that it has taken so long, is both overcoming the stigma that I mentioned initially, and then also coming to the realization that this isn't an inevitability and that there are things we can do. And so I think that's where the awareness is still needed. I also think people underestimate how many families are affected by this in one way or another, whether it's you yourself, your spouse, or an extended family member or friend. And I think there is growing awareness about how much this touches everybody. When I go into networking meetings now and I talk about what I do, there's a lot of nodding going on in the room of 30, 35 people saying, oh, yes, my grandmother or my aunt or my mother is going through this. And so I think that awareness is growing the more that it touches people. but it's sort of not the way we want to think about it. You have to experience it in order to be aware of the importance. And so we've got to continue to push on the awareness of how many people this is affecting, even if it's not affecting you directly. And so I think awareness of the numbers and the number of people living with the illness, but also the number of people who are caregiving for people with these illnesses. So I think this is where a lot of awareness is needed.
Can I ask a follow-on question to that too? So I mean, I was listening to something recently that was talking about how because women, I think, are more affected, or it's more common for women to have Alzheimer's, and I don't know if that's true or not. So please correct me if it's not. But part of it is that we haven't really studied how menopause affects our bodies, and we are, as things are often studied on men, they don't know all of this stuff in women's bodies, and so I think, as a midlife woman, you start thinking about these things and thinking, what's in my control to change, what's not. But do you feel like more is being done now to start studying this in women's bodies and how menopause could be affecting this and all of that?
Yes, absolutely. So there's a couple of factors in play here. One is, and I'm sorry for all the women in the room about what I'm about to say, but men die earlier from major issues like cardiac arrest, stroke, things like that. Women tend to live longer with chronic diseases. The longer you live, the higher your chance of establishing a dementia, right? Or progressing to the point where you can be diagnosed with a dementia. And so is it really that it's more common in women, or is it that women live longer? We don't know. That's definitely a factor, okay? And then the other piece is, how does women's health factor into this? And there are a lot of questions out there right now, particularly the hormonal end of women's health, and how does that affect or not affect brain health? And there's a lot of discussion right now about this. One of the things we know is a factor in all of these diseases under the umbrella of dementia is inflammation. And so the question is, what is causing the inflammation? And so we can identify these diseases like Alzheimer's disease, like frontotemporal lobe dementia, like Lewy body dementia. And we know that that's the cause, but we don't know why it causes the inflammation in the brain. The other thing that's happening that's really interesting is we're starting to see more mixed dementia diagnoses, which means there's more than one process at play. So you could have Alzheimer's disease and also have vascular dementia. So we're starting to see, in answer to your question, Liz, about where are we with these diseases, what we are finding is that the diagnostics are getting much better. We can detect the diseases earlier. We can look at different processes in the brain and say this is an Alzheimer's dementia as opposed to something else. We can see when there are more than one process going on in the brain. It used to be that we couldn't identify these things until autopsy. Now we have much better imaging, we have much better testing, and we're even starting to develop things like a blood test that could identify whether you have the gene for Alzheimer's disease or not. So there's a lot of the detection part of it that is getting much better. And the hope is that the earlier we can diagnose these illnesses, the better we can get at treating them. So right now, the school of thought is that by the time someone is symptomatic, by the time they're showing memory loss or loss of executive function or any of the other symptoms that come along with these diseases, this disease has been at play for 10 or 15 years prior. And when you say that to a family, they can often say, that's interesting because there was this couple of things I noticed, but we can't detect it that early yet. So what we're trying to do is detect it earlier and earlier and earlier into what they call this preclinical phase of the illness. And if we can do that, some of the treatments we have may be more effective if they're given 10 years, even 5 years earlier than they have been. So it's not that we don't have the right treatments, but that our detection isn't good enough to make those treatments effective.
So I have a follow-up question on that. Because so the things that you are saying are going to trigger some natural questions in people. So one is, so when you're talking about catching things at a preclinical phase, and I'll ask this for my own benefit, how do I do that? How do I go get tested?
A lot of people ask me this who have Alzheimer's disease in their family. And the first thing I want to say about it is there is a true familial Alzheimer's disease where the gene, if you have it, you absolutely will develop the disease. But that is very rare. And usually what happens is it wipes out entire generations of families, and it happens in younger people, like 30, 40 years old. So that's actually very rare. More often what we're talking about is the tendency. And here's the thing, you can have the gene and develop Alzheimer's disease. You can also have the gene and not develop Alzheimer's disease. You can also not have the gene and develop Alzheimer's disease. So all it is another risk factor that is on the same list as being obese or having diabetes or having heart disease, all of these things, right? So the recommendations still are Mediterranean diet, exercise, reduce your stress, improve your sleep. Those are the 4 things we can do to try to prevent or at least prolong the onset of these symptoms. So if you want to get genetic counseling, and some people do, particularly with these atypical dementias like frontotemporal lobe dementia and other dementias that have a very young onset, it can be important to know if you have a proclivity for that or not. But in terms of Alzheimer's disease, as I said, the research shows there's something else going on, either inside our bodies, it's part of our lifestyle, or it's part of our environment, and we just haven't been able to put our finger on it yet. And so certainly it is worth talking to, and I'm happy to give resources where you can go to have this kind of genetic counseling, but it's not a foregone conclusion. And so really what you have to decide is, how am I going to process this information if I have it going forward? And that's really a personal
For sure. So my next 2 questions, and if you can't answer them, that's totally fine. But you made a really good point. So a lot of people don't know how many families are affected by Alzheimer's and dementia. Do you have a number?
So it's important to recognize that most of the data that's out there is related to Alzheimer's disease as opposed to these other atypical dementias, but at least this will give you a sense of what we're talking about. So worldwide, as of 2015, there were 48 million people living with dementia worldwide. Those by 2050, that's predicted to be 136 million. So that's a huge increase in a short period of time, just to give you an idea. And then, let's see. In the United States, we have about 7 million people who are living with Alzheimer's disease and related dementias that are over the age of 65. So that's not taking into account the number of people who are younger. But really the number of people who are younger is about 3% of that number. So maybe that's helpful for you to know. So just so you know, by 2050, the number in the United States will be 13 million. It's really unbelievable. And it is the 5th leading cause of death among adults age 65 and older.
Yeah, and I think, well, that is the thing, and that's what you started out to say. Like, we're all worried about the person who has Alzheimer's, but then you look at what it does to the caregiver and you're like, and they're dying before the people with Alzheimer's. And I think that's, I think of Clear Guidance and think right there, like you are giving such an ease and relief to caregivers by the work that you do. And we will definitely get into that. I'm going to ask you a big question though. Do you think there's a hope for a cure?
Yes, I do. There's a lot of money going this direction right now. There's a lot of interest. And unfortunately, it's had to get to this point where this many people have been affected in order for us to really make it a priority. But it's also true that the baby boom generation has insisted on answers to things all the way through as they've gone through every decade of their lives. And there's every reason to believe this will be no different than how they've treated everything else. And so I think there will be a cure. I'm sure of that. I do think we are on the brink of some real big breakthroughs. How long it will take us to get there, I don't know. One thing I've learned in the last 30 years is that the brain is a mysterious organ, and it's extremely hard to study because everybody's brain is different at baseline. So if the three of us here on this call all had an MRI right now, and we're around the same age, all our brains would look different. And so when they are diagnosing these illnesses, they often have to take images that are 6 months or a year apart in order to make a diagnosis, because what they have to do is compare it to your baseline, unless it's really severe, and then they can tell right away. But this is the reason the research takes so long and diagnoses take so long, is because the brain is really mysterious. And my brain could have a bunch of places where I don't have as much neural activity as Shannon, but Shannon and I can do the exact same things. So it's mysterious. That's all I can say. And I think any neurologist would say the same thing. As much as we know, there's still a lot more that we don't know about the brain. And we can't go study it while people are living, because that would be highly disruptive. So it's a challenge, but I do think we will get there. I do.
So now just a little bit of pivot to you and Clear Guidance, and I'm interested looking ahead. What are your hopes and goals for Clear Guidance in the coming years in terms of dementia care and support?
I think that there's a lot of work we are doing around helping people to live well with dementia. And I think there is a thought that once you have dementia, it's all downhill from here, right? And you're only going to get worse, and you're not going to be able to do things. And we at Clear Guidance are really working toward the idea that people with dementia diagnosis can still do a lot. There's still a lot of joy and enjoyment of life to be had. And how can we help families to focus in that area and to put meaningful things in place for people with dementia, so that we're not spending the progression of this illness thinking about everything we're losing and focusing on the negative? How can we flip the script to focus on the things that bring people joy and bring people purpose and meaning in their life? And so a lot of what the work that we are doing is trying to help create that, both for our clients and for our care partners. That being said, there's no question that caring for people with this illness is so much harder than caring for people with other kinds of illnesses. And part of that is having to deal with what we call anticipatory grief, right? You're grieving the person as they're living with you. The person you are caring for doesn't look like the person you knew, doesn't act like the person you knew. And so in some cases, it feels like caring for a stranger, which is really difficult. And so it's tricky work to acknowledge the difficulty of being a care partner and helping those care partners to see moments and create moments of joy and meaning for those living with the illness as well as their care partners. So it's extremely important work. That is the vision and the purpose that we are focusing on. And every day we're talking about how can we do this the same or differently to get there. And so I think that's what will guide us through, what we do over the next 10 years and beyond.
Excellent. Great answer. And I'm going to go backwards now and say, can you please tell us what is Clear Guidance?
Clear Guidance is a group of experts that work together to create solutions for our clients that are caring for people with dementia, as well as people dealing with issues around aging and disability. And so we are a team of experts with various backgrounds. We have several different disciplines. We have social work, we have nursing, we have OT and PT, and we also have people with a background in working with nursing homes and working with assisted livings and working with hospice agencies and home care facilities. So we're bringing all of these resources to our clients. But anyone can Google. It's not just about naming the resources. It's about how do you use the resources? How do you introduce these ideas to your parent that might be resistant to help? And that's often a theme that we're hearing, either a lack of acknowledgement of the disability that the person is experiencing or resistance to addressing the things that they're struggling with. And our team is really expert at figuring out the strategy for introducing those in a way that's going to help both the person living with dementia as well as a care partner feel comfortable in the approach, in the transition to more support. So we do a lot of problem solving. We do a lot of what I call informed decision making. So we're helping families to think about what are the decisions they're going to need to make along the way. What information do they need in order to make a decision they're going to feel really confident in? And then what are the red flags that they need to be on the lookout for so they can anticipate and hopefully avoid crisis situations as things unfold? So that's what we do. That's what we're all about. I think when we were talking earlier about, what does this look like for families? And I think part of it is you go to the neurologist and you get this diagnosis that you've been dreading sometimes for years, and knowing in the back of your mind it's probably a reality, but having a neurologist say it to you is really difficult. And then the neurologist often says, okay, here's your diagnosis. We'll see you in 6 months or a year when we'll evaluate how much worse you are. And so people aren't getting the direction that they need from neurology. Neurologists just don't have the time. And we know this is the fact because getting an appointment with a neurologist can take 6 months or a year to even get your initial appointment. They don't have the time to guide people through what are the really difficult behaviors that you're dealing with? How do you address those? What are the things you need to anticipate as you go forward? What are your options for care? And where do you go to find the people that really know what they're doing as opposed to the person that's hung their shingle in your neighborhood? That's where we come in, and that's how we help families. And this can occur in a 2-hour consultation, or this can occur with a lot of hand-holding and multiple hours in person. And anywhere in between. So that is what we do and how we do it, Liz.
Yeah, it's amazing. It's amazing every time I listen to you talking about all the different things that you do and some of the very specific things that you do. So this question is going to seem redundant, but I'm trying to get at it from a different way. So the question is, what are some of the challenges families face when navigating dementia care, and how does Clear Guidance help and address these challenges? And I think what we're looking for is, identifying the challenges first off, and I'm sure there's some common ones, and then what you do to work through those.
Yeah, that's a great question. So I'll start with I'm sort of going to walk through where we see families in the continuum of this disease progression. So sometimes we're seeing families who are concerned about a family member. They've noticed changes. They're concerned about, what could this be about? And they've tried to address it with their family member, and their family member has said, I don't know what you're talking about, or there's nothing wrong with me, or I'm just having a little memory loss related to aging. And they know it's more than that, and they need to help figure out how they're going to have this person evaluated. So often we're getting involved at that stage to help guide family members into how do you address this? How do you have this conversation? And how do you guide this person toward getting the analysis we need to know what we're dealing with? Once they've had a diagnosis, often people are reeling from this information, even if they've suspected this for a long time. And so there's a lot of support for the care partner about, what does this mean for my life? What do I need to do legally, financially, practically to set myself up for this new reality? And often there's a lot of grieving that goes along with that. Many people have waited until retirement to do things like travel. And now the reality is that may not be something that's as easy to do as it was before. How am I going to adjust both my expectations and the practical, technical details of how we deal with this going forward? Then there are people that come to us because they've been caring for someone with dementia for some time, and there's difficulty that's come up at some point along the ride. So sometimes that's, I'm doing as much as I can as a care partner, and I need now support with the care of the person I'm caring for. And I've said to them, I need help and we need to get someone in, and they're resistant to that idea. And this is an extremely common scenario. Usually families have tried brute force method before they've come to us, and it's failed. And so they're looking for what's a better way to go about arranging this and putting this in place. So that's something we're often helping with. Sometimes there are things that are difficult. Often people with dementia are getting taken advantage of financially, or their finances are in disarray. And the question is, how can we gently but consistently transition this person out of managing the finances, but still give them the feeling of control, that they know what's going on with their finances, even though they're not involved in the day-to-day. So there are things like that we're working on. Sometimes people need to retire because their job, people are working longer and longer these days and doing it really well, which is wonderful. But it sometimes means that where the issues are being identified is at work. And we need to work with their employer to help them retire in a way that feels okay to them, and that the organization knows they're treating this person with respect. So often that's an issue we get involved in. And then there's a series of what I would call crisis or urgent situations. Someone's landed in the hospital. Someone's had an acute change in either their mental status or their behavior, which can happen sometimes even with a simple infection, can really throw a person with cognitive impairment for a loop. And the question is, what do we do next? Can this person come back home? Do they need additional rehabilitation or respite treatment in another environment before they come home? There's a lot of technical questions. How do I set up home care? Who do I know? How do I know who to go to? I'm thinking I might be at the end of what I can do. I need to think about another place for this person to live, or the safety issues have gotten so overwhelming that this isn't working at home anymore. Where do I find the best program for my loved one, and how do I go about telling them about this idea and making the transition to an alternate living environment? these are a lot of the challenges, very specific, but a lot of the challenges that we're seeing, the calls that we're getting, and then coaching families how to deal with these specific issues.
That's perfect. Yeah. Again, you named about 20 different things that happened in our life with my mom that I wish I would have had a resource like this for. So thank you for that. I'm balancing between two different questions, and I think with what you just said of this is how, there's a question here that says, how does Clear Guidance ensure that its consultations are thorough and tailored to the specific needs of each family?
Yeah, and I think this is something I've learned a lot about over the last year. I'm going to talk theoretically first, and then I'll tell you technically how we do this. So theoretically, we as an organization really believe that our service is valuable in finding what our unique value is to every family. It is not to duplicate or overlap what a covered service or an insurance company will pay for, right? It's to look at where are the gaps in the system for this particular person and how can we fill that gap. So we're really looking at where can we be valuable in this situation? And that is how we start. So when a family calls us, we offer a free consultation for every family that wants to find out about working with us. We ask them in depth. We often spend a great deal of time asking a lot of questions, hearing the backstory, and finding out what the particular challenges are for this client. And then we are crafting for them specifics about how we would intervene initially, what we would do, and then what would be our plan for the long term. So that's how it begins. Once someone becomes a client, then what we're doing is developing a care plan for going forward that outlines what are our goals for this client, what are the things we're going to work on, how are we going to do that, why is this important, and then, is this a short-term goal or a longer-term goal? And I think often, why this is so difficult for families is because they know where they want to go. And they want to think that it's a straight line between where they are and where they want to go. But it often isn't. And our experience allows us to know if the path it is windy, how we still end up where we want to go, even though we've had some detours off the plan. And that's where families get stuck, as they hit a detour and then they say, oh no, it didn't work. I don't know what to do now. Let me just tell mom she has to move to assisted living, right? Which rarely is successful. Our experts at Clear Guidance have worked with thousands of families around these kinds of challenges and know, okay, we've had this speed bump or we've had this detour. Now, what do we do? What's the next step? And how do we get back on track to meeting our long-term goal? So it's very detailed from the beginning right through till the end. I often tell our clients, our job is to work ourselves out of a job, which they think is really funny, but it's true, which is really what we want to do is get your family to the point where you don't need us anymore because things are working so well. And we can still exist in the background for backup as things change. But that's really the goal, is to figure out how to stabilize situations and how to anticipate the future so that we're not constantly reacting to crisis situations.
Expressive art therapy is a signature service of Clear Guidance. Can you elaborate on the benefits of this therapy for your clients with dementia?
Yeah. I think you saw my face light up when you mentioned this. This is something I am just so super proud of. And I will give the credit to, it was not me that came up with this idea, but I'm really excited about how we've incorporated and adopted it at Clear Guidance. So expressive arts therapy is a type of therapy that uses different modalities like music and art, bibliotherapy, visioning, movement like yoga, meditation, all kinds of different things to help our clients process depression, anxiety, and other symptoms that are characteristic of dementia and other related illnesses. So what often happens for our clients is they're experiencing anxiety and depression, but they can't articulate what they're experiencing. And so typical talk therapy isn't very effective. But what they can talk about is their emotions. And one thing we know elicits emotions, both positive and negative, is art and music and things like that. And so what this does is it helps to process those feelings without using words. We have seen some of the most incredible outcomes. Not only have we seen reductions in anxiety and depression, we have actually seen people regain skills that they prior had lost because they've reduced the anxiety. They're clearer cognitively. We have seen the effects of the therapy session, not just in the session, but for hours and hours after the fact. We've seen reduction in really difficult behaviors. We've seen reduction in agitation. We've seen improved mood. And we are sometimes going into facilities and giving this therapy and leaving. And there was a caregiver in an assisted living who told me, I work 3 to 11. When I come in at 3 p.m., I know whether this client has had expressive arts therapy that day or not, depending on what her mood is like and the way she's presenting. So I think this is tremendous. It's also meaningful and purposeful activity. They're often creating things. You've been to our office. Our office is filled with poetry and art and all kinds of other things that our clients have created. And this is one of the outside of the box programs that we've started at Clear Guidance that I am really very proud of and eager to spread the word about as much as I can. So right now we're offering this in a group setting, and we're also offering this in a one-to-one setting, and really hoping to engage people. Not a lot of people know what expressive arts therapy is or why it's used for people with dementia. And so we're big champions of this, and I'm looking forward to making this a bigger part of what we do.
That's fantastic.